Hi, my name is Amber Terhune. I'm the health educator for the Johnson County Health Department. This presentation is all about mosquitoes. Mosquitoes are actually one of the deadliest animals in the world, and they cause millions of deaths worldwide annually. They've been around for over 200 million years, and there are about 175 species in the United States. Here is the life cycle of the Aedes aegypti mosquito. The eggs may be laid one at a time or attached together. They stick to the container and only need a small amount of water. The larvae live in the water. They come to the surface to breathe, very active, and they're called wigglers. The pupa live in the water, they're resting, and they're in the non-feeding stage. The adults bite people and animals to feed, but they don't fly far. They lay eggs up to 300 at a time and up to 3,000 in their lifetime. Male mosquitoes live for about 2 weeks, and female mosquitoes live for around a month to 2 months. Female mosquitoes feed on blood for protein that is needed to produce eggs. The males don't lay eggs, so they don't need the protein and do not feed on human blood. Mosquitoes select their food source by the scent of blood, exhaled carbon dioxide, human sweat chemicals, and by detecting body heat. Mosquito bite reactions are caused from the saliva protein. Common reactions include swelling, soreness, and redness. You may have an itchy, raised white to red bump, and this bump may be hard. Some people may have more severe bite reactions. Skeeter syndrome is common in children, those adults who are previously unexposed, and those with immune disorders. Severe reactions include fever, hives, a large area of red, itchy, painful swelling, blisters and bruising, swollen lymph nodes, or anaphylaxis, which is a rare allergic reaction. Your throat, tongue, and face may swell, and you may have wheezing or difficulty breathing. If you have a known severe reaction, you should consider non-drowsy antihistamine prior to any potential exposure. You should see your doctor after mosquito bite if you have a headache, fever, neck stiffness, vomiting, nausea, body aches, or any signs of infection, and scratching the bites may lead to an infection. Do not break open any blisters. There are many options for mosquito bite relief. They can be over-the-counter topicals such as calamine lotion, Caladril, hydrocortisone cream, or a paste with baking soda and water, a cool compress that you should apply for a few minutes for relief, or an oral antihistamine for stronger reactions such as Benadryl or chlortrimeton. Many mosquitoes can carry diseases. They pick up the virus from one host and carry it to another. They, however, do not transmit the HIV virus as it does not replicate in their bodies. The virus is broken down in their stomachs. The diseases are transmitted by the Aedes, Anopheles, and Culex mosquitoes. Diseases include chikungunya, dengue fever, eastern equine encephalitis, Japanese encephalitis, lacrosse encephalitis, malaria, Rift Valley fever, St. Louis encephalitis, West Nile virus, western equine encephalitis, yellow fever, and Zika virus. Chikungunya, or chickpea, is found in Asia, Africa, Europe, and the Americas, mainly in the Caribbean. There are almost 2 million reported cases worldwide. There is no vaccine or treatment available. The incubation period is 3 to 7 days. Symptoms include sudden high fever, joint pain with or without swelling, which may be severe, long-term, and debilitating. The name chikungunya describes the stooped appearance of joint pain sufferers. You may also have a headache, chills, nausea and vomiting, rash, and muscle pain. Chikungunya is rarely fatal. Dengue fever is found in Asia, Africa, the Caribbean, and the United States. It is estimated that 390 million people are infected every year. There is no vaccine or treatment. The incubation period is 4 to 7 days. About 25% of those exposed will develop symptoms including fever, severe headache, pain behind the eyes, joint or muscle pain, and rash. The symptoms may become severe or fatal, and it may progress to dengue hemorrhagic fever, which is abnormal bleeding or very low blood pressure. It is the main cause of illness or death in the tropics and subtropics. Eastern equine encephalitis, or EEEV, is found in the Atlantic and Gulf Coast states, Great Lakes region, Central and South America, and the Caribbean. The United States averages 8 cases each year. There is no vaccine or treatment available. Incubation period is 4 to 10 days. Mild symptoms include fever, headache, and sore throat, and more severe symptoms include seizures, inflammation of the brain, permanent brain damage, coma, and death. About a third of those who develop severe disease will die. Japanese encephalitis, or JEV, is found in the East and Southeast Asia and Australia. There are approximately 68,000 cases each year worldwide. There is a vaccine available for those who travel to endemic areas, but there is no treatment available. Incubation period is anywhere from 5 to 15 days. Symptoms include a quick onset of high fever, headache, neck stiffness, stupor, disorientation, coma, tremors, convulsions, or spastic paralysis. Lacrosse encephalitis, or LACV, is found in the Appalachian and Midwestern regions of the United States. There are approximately 90 cases reported each year. There is no vaccine or treatment available. Incubation period ranges from 5 to 15 days. Symptoms include nausea and vomiting or headache, and more severe symptoms are seizures, coma, paralysis, and permanent brain damage. Malaria is found in Africa, India, Southeast Asia, Middle East, Oceania, Central and South America, mostly in tropical areas. Malaria has been around for thousands of years and causes more than 400,000 deaths every year worldwide. Most are in children under 5 years of age. There is pre- and post-disease treatment available. An incubation period ranges from 7 to 30 days. Common symptoms include anemia, fever, chills, nausea, and flu-like illness. Severe cases can lead to coma and death. Rift Valley fever, or RVFD, is found in Africa and Middle East. There is no vaccine or treatment available. Incubation period is from 2 to 6 days. Common symptoms include fever, weakness, back pain, dizziness, and weight loss, and rare symptoms include ocular disease, hemorrhagic fever, and meningoencephalitis. St. Louis encephalitis, or SLEV, is found in the United States, Canada, and Mexico. There is no vaccine or treatment available. An incubation period is from 5 to 15 days. The case fatality rate ranges from 5 to 15%. Common symptoms include fever and headache, and in severe cases, high fever, neck stiffness, stupor, disorientation, coma, tremors, convulsions, and spastic paralysis. West Nile virus, or WNV, is found in the Western Mediterranean, Africa, Middle East, Europe, and the United States. There are millions of cases reported every year. There is no vaccine or treatment available. Incubation period is from 3 to 15 days. Mild symptoms include fever, headache, body aches, fatigue, skin rash, and swollen glands. Rare West Nile encephalitis, or West Nile fever, can cause headache, high fever, stiff neck, disorientation, muscle tremors or weakness, and paralysis, and it can be fatal. Severe illness and death is more common in those over 50 years of age. Western equine encephalitis, or WEEV, is found in the United States, Canada, and South America. There are less than 700 cases in the United States since 1964. There is no vaccine or treatment available. Incubation period is from 5 to 10 days. The case fatality rate is from 5 to 15%. Symptoms may include a mild flu-like illness such as fever, stiff neck, muscle pain, headache, or lack of energy. It may lead to encephalitis, coma, or even death. Yellow fever is found in the tropical areas of Africa and South America. It is estimated that there are 200,000 worldwide illnesses every year. There is no treatment available, but there is a vaccine. Incubation period is from 3 to 6 days. Symptoms include fever, headache, muscle aches, nausea and vomiting, dizziness, and jaundice. Zika virus, or ZIKV, is found in about 40 different countries. There is no vaccine or treatment available. Incubation period may be several days to a week. Symptoms include fever, rash, headache, conjunctivitis, and joint and muscle pain. Hospitalization is uncommon and death is very rare. Pregnant women, however, should avoid traveling to endemic areas as this can cause microcephaly in the baby. This is a congenital defect of the cranium and brain size, which will lead to neurological defects and can result in infant death. There are many ways you may prevent mosquitoes from breeding. Empty and clean any items holding water once a week, both inside and outside. Clean out the bird baths, any tires lying around, buckets, planters and saucers, vases, and fire pits. Turn over any outside items when not in use, including wading pools, wheelbarrows, and canoes. Cover storage containers with a lid or a wire mesh with holes that are smaller than the adult mosquito. Also buckets and rain barrels. Drill holes at the bottom of large containers, such as garbage cans, large plant pots, and the bottoms of tire swings. Clean out the roof gutters, removing the leaves and debris. Treat large areas of non-drinking water with larvicide, such as ponds and drainage ditches. Keep the pools clean with chlorine, and remove any standing water from the pool cover. Stock ornamental ponds with fish, as they eat the mosquito larvae. You can also release dragonflies, as they prey on adult mosquitoes. Remove any overgrowth, including tall weeds and grass. You can also use landscape to prevent overgrowth. Be sure to clean out or remove any hollow trees. Inside, you may use indoor flying insect spray, aerosol, or foggers, as they kill current mosquitoes. Treat their resting areas, such as cool, dark, humid areas, in closets, showers, and under the sinks. People and pets must leave the home when aerosol or foggers are used, and you may return home after they have dried. Outside, you may use outdoor flying insect spray. Use it where mosquitoes rest, such as the dark, humid areas under the patio furniture, in the carport, and the garage. Repair any septic tanks, such as cracks or gaps. Cover any open vent or plumbing pipes with wire mesh that is smaller than the adult mosquito. Do not overtreat your yard. Consider using a garden hose instead of a sprinkler system, and ensure there is good irrigation. You should always take precautions to prevent mosquito bites. When using insect repellent, be sure to follow the directions. Do not use a combination sunscreen or repellent, as you are more likely to need sunscreen more often than the repellent. Apply the sunscreen first, allow it to dry for about 20 minutes, then apply the repellent. Do not apply the repellent to skin, which will be covered by clothing, and also do not apply it to any compromised skin, such as sunburns, cuts, wounds, and rashes. Apply the repellent outdoors, away from food. You may also use permethrin-treated clothing and gear, such as shoes, clothes, and tents, but do not use permethrin on skin. EPA-registered repellents recommended by the CDC include DEET, and you should use at least 20% concentration for adults, but not more than 10% on children. DEET may offer longer-lasting protection than others. You may also use picaridin, oil of lemon eucalyptus, OLE, or paramethanediol, PMD, IR 3535, and 2-undecanum. Reapply the repellent every few hours and wash it off with soap and water. You should always cover up, especially from dusk to dawn, as the mosquitoes are generally more active during this time. You may also avoid outdoor activities when the mosquitoes are more active. Wear light-colored, tightly woven clothing, as mosquitoes may bite through thin clothes. Wear long-sleeve shirts that you tuck into your pants, long pants tucked into socks, and socks with closed-toed shoes. You should also wear a hat. You may wear one to protect your ears and neck, or you can use one with mosquito netting. Some considerations for children include there are no repellents available for those under 2 months of age. Instead, you should use a mosquito net over their carriers, strollers, car seats, and pack-and-plays. You should also use clothing that covers the skin. You should not use any OLE or PMD products on those under 3 years of age. Do not apply it to their hands, their mouth, any cuts, or irritated skin. Children are likely to put their hands in their mouth, and they may rub their eyes. Adults should apply the repellent to their own hands and apply it to the child's face. Be vigilant about mosquitoes. Keep them outside, use air conditioning, make sure that your window and door screens are intact, and sleep under a mosquito bed net if necessary. You should tuck the net under the mattress. You can also use a permethrin-treated net as it offers more protection. Do not wash treated bed nets or expose to sunlight, as this breaks down the insecticide. This concludes the mosquito presentation. If you have any questions, you may call your local health department, or there are many websites available online. Thank you.